It's time now for this week's mental health moment. June is Men's Mental Health Awareness Month. Men die by suicide at 4 times the rate that women do. And of the 19% of men 18 and older who experienced a mental illness, less than half actually get treatment. Here with us to discuss is Sweetser spokesperson Justin Jeanette. Justin, thank you so much for coming in today. So what are some signs that we should look out for, that men should look out for, and people should look out for in their friends?
Absolutely. So men oftentimes externalize their feelings when it comes to mental health distress. So some things to look out for: aggression, irritability, sometimes being on edge, maybe withdrawing from social activities. It could also be about substance use and more high-risk behaviors. So those are the things to look out for. It might even be having difficulties just enjoying typical experiences and having positive emotions. So again, because men tend to generally externalize those feelings, those are the things to look out for.
Why is it, do you think, that men might not seek treatment if they're struggling with mental health issues?
We've come a long way with reducing the stigma attached to seeking mental health in general, but for men, the pressure is still there. What we see is societal expectations and norms around men having, and masculinity in particular, having to feel strong, like I can tackle anything on my own, and even almost like a withdrawal from exuding sort of emotional reactions. And so what we see is that translates into underdiagnosing mental illness and seeking out mental health support. We see it in the data. The fact that nearly 80% of suicides in this country are men speaks directly to that. And I think a highline message is it's not weak to speak. It's not weak to speak. So I think it's important for folks to think about this like this. I'm not an electrician. You would not want me fixing your electrical system in your home. That's why we would hire a professional, right? And so much like your mental health, you want to make sure that you are bringing in the folks that know what they're doing, that have that expert. It's a smart, sound decision. So really thinking logically about how you can bring in that support into your life.
And what does that support look like?
Yep.
It could be, it's definitely professionally needed, but also how do you support someone who you think might be going through something?
It's about starting to engage, right? Oftentimes it's asking more open-ended questions. That typical "how are you?" Our initial response is "I'm fine," right? "How are you?" has become the new "hello," right? And so I think going beyond the surface there to really ask, maybe there's a specific stressor in that person's life that you want to ask a little bit more in-depthly about. That helps to sort of open up the conversation a little bit. So I think those open-ended questions are important. I also think showing positive examples of folks seeking professional help is important. Maybe Susie Q or Johnny John down the street, right, are tapping into therapy, and there was such a positive experience for them. Just highlighting that is important. I also think being patient with folks. Sometimes because of those societal expectations put on men, you may have to peel back the layers a little bit, right? And so I think it's okay to ensure that there's non-judgmental, conversations taking place, that you give folks the time and the space in order to open up. All of that is critically important.
All right, Justin Jeanette from Sweetser, an important conversation. We appreciate you coming on the show.
Thank you.
The professional support line is on your screen right now. Again, thank you for coming in, and we'll be right back.